One of the things that disturbs me a great deal is people talk about the looming crisis of healthcare and the looming crisis of the baby boom coming of age. I got news for y'all. It's on us. I am already seeing these cases and these crises all day, every day. My phone rings off the hook. You know, with the elderly that I work with, or their families, their sons and daughters who are adults who are also taking care of children, are stretched at every end. They're having to pay for caregivers in their homes, or they're having to pay for assisted living care, for memory care, particularly for Alzheimer's or dementia patients, or they're having to pay for nursing care. Now, nursing home care, if you are in rehabilitation, if you were in a hospital and went to get pumped up and go back home, Medicare is going to pay for most of that. Not always, but most of it. But after 20 days, now you're paying out of your pocket for long-term care, $7,000 or more every month for nursing care. So if you're having to pay for that out of your pocket, you're going to run out of money pretty quickly. Even if you've saved all your life and invested all your life and you have a home, it's unsustainable.
Yeah.
It's not even unsustainable, it's impossible. And that's what happens.
So this would be someone who's in the nursing home and they're told that they're going to have to sell the house.
Yes. There basically is no other way to pay for your care other than to deplete your assets. And once you do that, once you've spent down to a certain point, then and only then is Medicaid going to kick in. And typically the kind of care that's provided at Medicaid certified nursing homes is the kind of care that you would expect when you're on public assistance. There are not enough people providing care, so the care really suffers even though you're paying everything you have for that level of care.
But when you saw recently the proposals, I mean, first there was the House bill that was going to take health care away from 23 million people. What does that mean for elderly patients?
It means that they have to find another way to be cared for, or they're going to find themselves on the street. So let me tell you what happens when someone can't pay for their care. This is against the law, but it happens. I saw it happen. There is a particular nursing home in our community that when someone, for whatever reason, was not able to get Medicaid, either the social workers didn't do the application right or the family wasn't able to handle it or whatever, he was essentially homeless because he no longer had a home and he needed nursing home level care. And they said, well, we can't take care of you because you can't pay the bill. And do you know what they did? They put him in a taxi and sent him to a homeless shelter. Do we want to treat our old people this way? I don't think so. I know I don't. But that is what happens because you have for-profit nursing care that is not able to get paid. What are they supposed to do? Well, I hope that they are not going to be in the habit of putting people in taxis and sending them to homeless shelters. But that's what we're facing.
So with someone like me who hopes to go to Congress, what can I do?
There are two things that I think have to happen in Washington. One is we have to fund these programs. We have to find a way to pay for the care that these people deserve. I'm not exactly sure what that entails, but it has to happen. The other thing that has to happen is the existing care that we have, nursing homes in particular, but also assisted livings and some other settings, they're not well regulated. When somebody calls me, as I said, from the hospital, mom's in the hospital, she broke her hip, she's going to a nursing home, what do? We don't understand. You're mostly thinking about, I need to get mom settled, and we need to get her comfortable, and we need to get the PT started. And what happens is they push this contract under your nose, and the contract is about 1.5 inches thick. The people in the nursing home open the page and say, sign here, sign here, sign here. And people are emotionally exhausted and very stressed out, and they don't read those contracts. And those contracts are very unequal. They're having to sign things where there's no negotiating power. What comes into play is regulation. That's what puts the thumb on the scale between the quote-unquote consumer of healthcare, the healthcare provider, and some control and some equal leverage in making sure that the care that's being promised in that contract is actually delivered. And we're not doing that. In fact, what's happening in Washington right now is they're saying, we want to deregulate these nursing homes.
So when you deregulate a nursing home, what are some of the abuses that you see?
Wow. People die, for one. You know, they develop bed sores, which should never happen. There are ways to prevent these things from happening. And when someone goes into a nursing home, and the families generally put them there because they don't know how to take care of them. They're expecting them to know how to take care of them. And so they only discover something is wrong when something is really, really seriously wrong, and by then it's often too late.